Good morning. This is Dr. Timothy Scott Mick here at LifePoint Medical. It's my weekly video update, and I want to let you know that we're doing great here. It is February the 6th of 2022. So let's go ahead and get down to business. We are open. We're taking patients steadily. We're taking new patients if you know somebody who needs a doctor. I've added Brian to my provider mix this last week, and he is doing really well, and he's going to fit right in here perfectly. And certainly, if you come in the office, if you haven't met him, you can ask to meet him. He's a very nice guy, got a lot of experience, and he's a welcome new addition to our team here. Let's talk about some other new things. This Friday will be the beginning of when Dr. Cecil Brown, who's a general surgeon out of Toccoa, will start seeing patients on Friday in the women's clinic. And he's going to do this every other Friday. Him or his nurse practitioner will be there. And we're using them for general surgery services. One of the ones that we always talk about is colonoscopy or an EGD. Colonoscopies look through the bottom, and EGD, you look through the top. He can perform both of those and can be a streamlined, local way for you to get those services in a great manner with no loss of convenience. Now, he won't do the surgeries or anything like that in the office. He will do them in Stevens County, which they're the ones that approached me about doing this. They have been very proactive about trying to incorporate some of the services that I need that aren't offered here in this community. They're offering to set things up and streamline them for us, and I'm like so appreciative of that. And it's a great little hospital. I had two babies there, or my wife did. So we're working with them, okay, because they want to work with us to try to promote local services as local as you can get it. So these services are already established. They got a great facility. A lot of the procedures and protocols are all set up, so let's use them. And I'll keep an eye on them. They're close contact with me. They're going to talk to me and let me know, and they're going to be communicating with me and helping me out when I need to, which is invaluable when it comes to some of these services like general surgery, because I want people to help me, and I want to help me quick, get people taken care of when they need to be taken care of. So that's hopefully the relationship that we're going to continue to have with Dr. Brown and Stevens County Hospital. I mentioned last week we've got these weight loss shots. So this is the semaglutide. This is the medicine that they're having trouble getting. There's a nationwide shortage of it, and plus they're trying to restrict the use of it to only diabetics. We found another source for it that's competent, and we can provide you with that medicine. We actually buy the medicine for you, and we keep it here, and we administer the injections, and we also give you some medical management with that. It is a cash pay type service, but it's affordable, and it's, I think, cheaper than the other ways people are doing it for the most part. So if you're interested in that, come on in. Go ahead and make an appointment to discuss it. So we got to get a few things out of the way and make sure we're doing everything just right, and we can start you out with that pretty quick. We already got several people signed up for it, so I think it's going to be a very popular program. Okay, the remote patient monitoring and chronic care management is going really great. Both of these products are essentially set up by Medicare, but the other insurance companies are caught on, like with the remote patient monitoring, insurance companies do that. So remote patient monitoring is when we send you home with equipment related to exactly what we want to monitor, like your blood pressure, your blood sugar, or your weight. And the system is set up so that we get automatic feedback based on your recordings electronically. And there's a team of nurses in Texas that monitor all these for us. So if you haven't signed up for the RPM, we're here for you on that. Bring it up in the appointment, and we'll get you all set up because it's working. Now, the chronic care management is a similar program. It's mainly for Medicare patients, though, who qualify. Like they have criteria. Most people do qualify for it, and that's where I have a nurse that is continuously monitoring and trying to help you out throughout the year with certain protocols and things that we do to ensure your safety and to make sure everything's done right. Chronic care management and RPM are new payment methods for us, and it looks like this is what they are swinging towards. So it's real important that we get participation in these programs, because that's what's going to keep us alive and well here. So let us know if you would like to participate. And then last but not least, I just want to give you a little clinical pearl. So I use family history as a very powerful tool when I'm talking to patients, or I'm trying to figure out what patients are at risk for, or what they might be able to mediate as they get older. And so it's really important. So there's some things that I go by. First of all, if you have a parent or both parents that have a particular disease that pops up at a particular time, and you live your life and you don't recognize it and you don't do anything to mediate it, there's a pretty good chance that you're going to fall victim to that disease around the same time. Okay, so we can take that knowledge and look at your parents, and we can say, okay, what's these risks coming up that we need to mediate? What do we need to change? What do we need to do? A common one would be my dad had and I'm just using this as an example, it's not talking about my dad, had a heart attack at 55 years old. Okay, and let's say you're 50 and you're like, what do I need to do now? Okay, so did your dad smoke or not? Okay, because that makes a big difference in the development of heart disease and things like that. If he smoked and you smoked, and he was overweight and you're overweight, and he didn't exercise and you didn't exercise, you can kind of go ahead and plan on having a heart attack at 55. Now, it's not 100%. You don't know the future, but you can use that data to stop doing things that do correlate with the recurrence of that disease for you. And that's how I use family history. So if he smoked and he didn't exercise and he was overweight, and you didn't smoke and you don't exercise and you're overweight and you're 50 and you're like, hey doc, am I at risk of having a heart attack? Absolutely. Let's mediate the risk factors. Quit smoking, lose the weight, start exercising, and then we look at your lab work and we put you on medicines that can mediate that risk, and we can make a difference in that family prediction that you were looking at. It's a very powerful tool. It's not 100%. And genetically, you don't know what you did or didn't get from your own family. But you can use that as a reference and use that as some kind of a predictive model to modify your lifestyle to hopefully mediate your risk as you go forward. So those are the things that I look for in family history. Like if you're a female and you have a family history, your mom and all your aunts and your grandma had breast cancer, we can take that data and say, okay, this is what we're looking at. It looks like we need to do some more testing to see what your risk factor is for breast cancer. See if you've got a genetic predisposition for it. And then how do we mediate that? How do we surveil that? How do we look forward to that so that you don't have to suffer from the same disease? That's what we try to do with family history. So family history is extremely important, and you'll often hear me and my other colleagues asking you about family history so that we can set up a relatively accurate predictive model for what might happen to you and help you mediate that. All right. This is Dr. Timothy Scott Beck. I've talked too much today already. Thank you so much for listening. You have a great day, and you please call us at 706-782-0016 if you need anything. Thank you.